The Ice Hockey Summit 2 Action on Concussion is a Mayo Clinic Sports Medicine Center scientific program that will generate an action plan to reduce the severity and risk of concussion in the sport of ice hockey. We've made great strides since the first Concussion Summit, which took place in 2010. In the area of education, we now have programs for coaches, parents, players, and officials, including mandatory coaching education at USA Hockey that's part of the certification process. We have emphasized enforcement of existing rules with the hope that we can minimize dangerous activities like charging, boarding, and checking from behind. We've made rule changes to minimize or hopefully eliminate hits to the head and fighting. USA Hockey has now made legal body checking in games possible only at the bantam level beginning at age 13. USA Hockey has also put together programs to teach body contact, control, and checking skills at younger age levels so that players are ready to begin body checking by the time they become a bantam. Our Summit 1 and 2 are focused on action items that will improve safety in the sport of ice hockey. However, the researchers and scientists and experts that we have coming to Rochester are actively involved in concussion education, prevention, and treatment for all sports. And we're very hopeful that what we learn and discuss at the Summit 2 will be applicable to athletes who are participating in a variety of other sports. We set up the protocol for the summit as a group discussion, but also we actually vote on prioritized action items. So the work begins after the summit. We don't just discuss the science of concussion and prevention and management and long-term sequelae. We actually want to publish symposium synopsis, but we also want to take these action items forward and try to implement changes that will improve the safety of the sport of ice hockey. Well, the Summit 2 will be similar, yet we are going to address the basic science aspects of concussion. There are some research collaborations going on which hopefully will give us a window into the brain, not only looking at the neuronal level, but also more sophisticated imaging so that we can better understand the pathomechanics or the metabolic cascade that leads to a concussion. Better understanding of these issues might allow us to come up with strategies for prevention or early treatment and therefore better management of our athletes.